this is a place where great health care happens, but in a place that's really warm and inviting, personal and caring. And that has been true from the day we opened until today.
I think people really enjoy practicing here. It's laid out in a way that's conducive to the way they want to deliver care. When you think about it, it's 2-point-something million square feet under one roof.
What has surprised me over 25 years is this campus has maintained the level of quality and the looks and also the collaborative nature that it has. And I think that the architecture and everything has helped enhance that.
When we were interviewed, it was extraordinary to be coming to a project where they had 250 acres of land, unoccupied.
We really were 3 separate organizations, a medical school, a hospital, and a large group practice, who had worked fairly independently over the years.
We involved the staff and the families and the patients who would be served there and really listened carefully to what was unique about that space and tried to really design with those intentions in mind.
The medical mall developed from a point of view of how people circulate through this entire complex.
So each component function had its own footprint, but all connected together with this street, the mall. I think keeping the natural light was crucial to the institution. I mean, we're here now in early March. It's snowy and cold outside. We needed to bring light into it. And light became the organizing structure of finding your way.
When you think about our inpatient towers and literally just the view from each patient room, which is sort of a soothing view of woods and mountains, I think that's very conducive to what we're trying to do.
We had certainly a vision for the site in our design. We knew that we would expand. Most of us never dreamed it would happen as fast as it has here. We've more than doubled, and it's kind of like, wow.
I would say that this was the most challenging project that the firm had taken on, both from its size and complexity and just by the sheer numbers it had to deal with.
Well, the first day that the Medical Center opened, October 5th, 1991, was a very exciting day. I remember we had our first baby early on in the morning. We had our first OR case running by 7 o'clock that morning, and in some ways it felt very familiar, but in other ways it just felt very new.
A number of years after it opened, I ran into a young woman in Hanover, and she was saying to a friend, "I'll see you at the mall later today." And this was the mall.
We still have patients and families walk in for the first time who really exclaim that it doesn't feel at all like they're coming into a medical center, and that's the effect we wanted.
In roughly the last decade, our inpatient admissions have grown by probably 30%. Our OR cases, roughly 60%. 1 in every 4 inpatient surgeries in the state of New Hampshire is performed here. And so when I think of the original vision for this facility being that academic medical center to serve a rural area, it's really stood the test of time and done exactly that.